Hello everyone, welcome back to the Shintaro Higashi Show with Peter Yu. Today we have a very special guest, Dr. Doug Krohn. Thank you so much for being here.
Thank you for having me.
So you are a expert, right, in the skincare field. You own CLM Skincare, correct?
No, actually, I'm on the medical advisory board of Clean Skincare, and I'm one of the pediatric representatives for Clean Skincare.
Awesome. And I thought this was kind of a perfect union, you and us, because there's a lot of misinformation when it comes to grapplers and skincare. So one of the things that, like, for instance, mat herpes is like sort of a thing. You ever heard of that one?
Yeah, so we call it herpes gladiatorum, or herpes of the gladiator, herpes of the warrior. I don't know what's a myth about it. It's a very real thing, and it could be a very big problem.
Oh, yes. But the medication is still Valtrex, correct?
So Valtrex is one of the medications that can be used. It can be used to treat people who have an infection. It is also
Yes.
available to people preventively. There's some people who take it every
Mm,
day or every day
yeah.
during the wrestling season if they're very
Yeah.
prone to it.
So, what is the difference between like oral herpes, general herpes, and then the mat herpes?
Well, there isn't a very big difference. It really
Mm,
has to do with where it is on your body and how you communicated it.
mm,
Um, Oral herpes is usually herpes simplex virus 1, but it doesn't have to be. It could be
yeah.
herpes simplex virus 2. Genital herpes is
Mm,
usually herpes simplex virus 2, but it doesn't have to be. It could
yeah.
be type 1.
That's the worst one, right? You really don't want that one.
I don't think any of them are particularly good. And
Yeah.
for reasons that I don't agree with, I think that there's more shame placed upon the
Yeah.
genital herpes. But,
Yes, for sure.
the mode of transmission is the mode of transmission. We don't attach
Yeah.
a moral judgment to it. And
Mm,
I don't think any of these things are anything that somebody wants to get or chooses to get.
no. Yeah. Because I remember when I was wrestling in high school, there were skin checks, and at New York State Championships, I was wrestling for third, and this kid had stuff all up inside his beard.
Uh huh.
And we're going to talk a little bit about shampoos and cleansing products. That's why you're here, right?
Yeah.
So this kid had all these like bumps and stuff, and he was a dark skinned kid with dark skinned beard, so you couldn't see unless you're like really close to him. I shook his hand, the whistle blew, and then he put his face against mine, and I got it.
You
I
did.
got it all over me. Yeah. And then they gave me Valtrex, and I kept telling everyone, mat herpes isn't really herpes. But then everyone's like, ew, you have herpes? And then, I was like, it was like so shameful. You know what I mean? And I was so pissed that I got this thing. But I never had a flare up after that. So, like, what is
Right. So
up with
not
that?
everybody who gets a primary infection will get a recurrent infection.
Uh,
Many people do, and there's lots of things that could put you at risk of that. Skin trauma, which is obviously a big risk factor for wrestlers, judo
yeah.
participants, etc. Sun exposure, a different illness, stress, these things can lead to
Yeah.
recurrences.
So I remember when I was in high school, I told Mike, I was like, yo, he had all this stuff around his chin and neck. It was disgusting. Am I going to get it? He said to me, don't take a hot shower because it'll open up your pores and the herpes will soak into your skin. True or not true?
I'm going to say probably not true. I think
Oh, that's a myth. That's a grappler's skin myth.
the bigger issue is that there was a breakdown in your skin integrity.
Hmm.
Maybe it was from trauma, rubbing against your competitor, rubbing against the mat.
Yeah,
Maybe it was eczema that you had underlying or a previous skin injury like a scratch. But there was a
yeah.
breakdown in skin integrity, which allowed the herpes virus to penetrate your skin and then infect you.
Because I was in high school, I probably had pimples on my face already, right? And I used to pop them. So that break in the skin is where the herpes virus went into my skin. Is that right? To make
I
that
can't prove it,
guess?
but if that's your
Yeah.
theory, sounds plausible to me. And we could talk about
So if a
acne in
guy,
athletes also if you
yeah,
want to.
yeah. So if a guy has that, right, like herpes virus, but you have no lesions in your skin, and the pus gets onto your skin, because maybe the guy doesn't know he has it, and you're wrestling or doing jujitsu with the guy, right? This will never happen in judo, but right
Right.
then, like, what could I still get it?
If there's no breakdown in skin integrity, you don't have a cut, you don't have irritation, it is less likely, but I can't say that it's impossible. Remember, people have small breakdowns that they're not even aware of.
That's very true. That's very true. Okay, so other things that can potentially happen, right? So very, very common is ringworm, staph, impetigo.
Right.
Those are like the main ones. You could, jump in there and tell me maybe there's more, you know?
You absolutely have hit on the biggest culprits.
Yeah.
Herpes, fungus, as you said, and staph infections, and non-staphylococcal skin infections too. Impetigo is a skin infection with a very characteristic appearance that is usually caused by staph in wrestlers, but it could be caused by strep also, including the same strep that gives you strep throat.
Oh.
Less common in the wrestlers.
Yeah. So when you're going, like, I know for a fact, right? Impetigo is probably one of the most contagious ones. Is that it's something that's like a myth, or is that like a real thing?
No, that's extremely contagious. And so now you're talking about somebody who has an active infection on their skin, and then an active infection, if rubbed against non-intact skin, well, there's a very high rate of infection. And even against intact skin, if the load of bacteria that's introduced is very high, you even have a risk there.
Yeah, I got it a couple weeks ago. Not a couple weeks ago, like a month or two ago. Somebody had it on their neck, and then I got it on my neck, but then it moved up into the hairline, right? So I treated the skin on my neck, and I was like, oh, it's good. But then it like creeped up into the back of my hair. I have long hair, so it's like, and then it was absolutely disgusting. And you have a shampoo to combat that?
Okay, so what Clean Skincare has is a body wash and a sport wash that has sodium hypochlorite in it. And sodium hypochlorite, also called bleach, when it's in a pool, called chlorine, it has the ability to wash away bacteria, wash away fungus. And it is recommended that athletes wash themselves within 30 minutes of a practice or a competition to reduce the incidence of bacteria on their skin, colonization, and infection.
So the temperature of the water does not matter at all whatsoever.
The temperature of the water in the shower?
Yeah, because like I said, like there's a myth about hot shower can open up the pores, therefore you're much more likely to get it.
I'm open-minded to anything being possible, but I doubt that the temperature of the shower water is a giant contributor. It has to do with introduction of the germ, the microbe, the bacteria, the fungus, the virus, whatever it is, and the possibility of a loss of skin integrity, a little breakdown in the skin.
Okay. So would you say like within 30 minutes after training, you should definitely take a shower? Is that like the right thing to do?
That's actually the recommendation of the National Athletic Trainers Association. That's an official policy stance. So if you can get that shower in and get in with something that is effective at washing away microbes, that is ideal.
Interesting. So similarly, like across all the different skin infections you could potentially get, that shower wash immediately can beat all of them. Like it's the same sort of treatment.
Reduces the incidence of. Nothing's 100%.
Okay.
But yeah, that would be a good strategy for reducing the chance of a viral skin infection like the herpes you were talking about. That would reduce the incidence of a bacterial skin infection like the staph and impetigo that you were talking about. And also fungal.
Fungal, yeah, because athlete foot is a real thing, right?
Athlete's foot is definitely a real thing. And
that's a big one for grapplers because a lot of judo, jiu-jitsu guys, they grapple without any shoes. So now, you see it. Like you look trying to like break someone's ankle and you're looking at their feet and it's crusted over. And then all of a sudden you got these crusty feet, right? So what's the protocol for that? Same idea, just clean shower?
So if you're talking about an infection, the cleansers The clean cleansers and other cleansers are not appropriate for the treatment of infection. They're good for cleaning yourself in the shower. If you have an infection, you need an antimicrobial. So antibiotic if it's bacterial and antifungal if it's fungus or yeast.
Interesting. Okay, so wash afterwards and then cream to prevent the fungal infections, right?
Cream to treat a fungal infection. You probably wouldn't use an antifungal as prevention. We generally reserve those agents for when you're actually infected. And that's why a body wash and a sport wash like the clean body wash and the clean sport wash is good as part of a cleansing regimen for athletes. Because, the idea is to have your skin clean before you ever get infected.
So there used to be this thing called Selsun Blue or like dandruff shampoo.
Yeah.
And then they used to say like dandruff shampoo can kill all this stuff. So we used to take Head and Shoulders, wash our head, and then lather our entire bodies with it. But I have like really sensitive skin. You know what I mean? So it's like I didn't really like how my skin felt afterwards. But is that like a real thing or is that like a myth, grappling myth?
About the Selsun Blue?
Yes, I think the ingredient was pyrithione zinc.
Yeah, so that's what's in Head and Shoulders.
Yes.
And in Selsun Blue, I believe it's selenium that's in there.
Oh, nice.
So in those doses, those aren't going to be great for treating an infection. They'll do something, but they're not going to be great. You may need an actual oral or topical prescription or over-the-counter antifungal.
Yeah.
But using it in kind of a preventive manner might be reasonable. But you brought up the fact that it's very irritating to your skin. Those are very strong things to use over your entire body. Cleansers, for example, the clean skincare sport wash, it's a combination of a surfactant, which is a soap, with the sodium hypochlorite. And so that's going to be a gentler and more traditional kind of cleansing option.
So where can like my listeners, if they're listening, or watching this video, like where can they find some of these products?
Right. So the clean skincare products can be obtained directly from the Clean website, which is cleanwash.com. You can get it from Amazon.
Oh, nice.
You can get it directly from Amazon.
Wow, interesting. So what about like guys who have like body, like, some people who have like when you're about to, I don't know if you grapple at all, but like when I grapple, sometimes I smell people and they're like, oh my God, it's disgusting.
Right.
And there's some things, right? Like we wear judo gis and t-shirts and rash guards, and sometimes even though their body is clean, but something in their sweat or whatever it is, bacteria gets into the fabric, and even though they wash it, when they start sweating into the uniform, it all immediately starts smelling again, right?
Right.
So is that like should tip me off? Like I don't want to work out with this guy because his situation's unsanitary, or like what is that about it, and what can we do about it?
Right. So body odor, and the official name of that is bromohydrosis, or the medical name. Body odor has to do with what's called your skin microbiome. So those are all the bacteria and, for that matter, fungi that are living on your skin that aren't necessarily infecting you. But you may have an imbalance. You have too much of one or a few different types of bacteria or fungi on your skin surface. And that begins to not smell so good. Washing those away, cleansing away those microbes will reduce the incidence of body odor.
Okay. But then what about when they start sweating into the fabric though? Like, is that what can they do to like treat their uniform? Is it like
Right. So
just buy a new one?
So
that's what I tell my guys. I'm like, yo, if it starts smelling, just buy a new set of uniform.
Right. So clean sport wash is a lot of good things, but it's not a detergent. You can't use it in place of Tide. You're going to have to take that stuff and wash it. And what I would say, and this isn't an official recommendation, and this isn't even my recommendation as a pediatrician. This is my recommendation as the father of 4 competitive athletes. Wash those clothes immediately after the practice or competition.
Yeah, that's the key,
That
right?
you got to do that.
Yeah.
Otherwise, they say. I mean, have you ever smelled someone's hockey bag or lacrosse bag?
Oh, it's disgusting.
Yeah.
I smell guys who take their judo uniform, leave it in their bag overnight, forget about it, and bring it into class the next day. And no matter how many times you wash that thing, it's done.
Right.
It's cooked.
Right, and then all of the microbes, the fungi, the bacteria that was on that person's skin, depending on how long ago it was that they took the uniform off, it's still on the uniform. I would wash that stuff frequently and immediately.
So do your kids grapple at all or no?
No. So I had basketball and lacrosse players.
Okay, so it's not as prevalent, right? Skin infections in those sports?
Not as prevalent. So by far the most common is grapplers. So wrestlers,
absolutely,
75% of athletes who get skin infections are wrestlers.
Yes, 100%.
A distant second place is football players.
Distant, way distant.
Yeah, but it's without a doubt wrestlers regarding the skin infection.
So you're bundling in that wrestler umbrella, jiu-jitsu guys, judo guys, grapplers, period, right?
Mat athletes,
great. Yeah. Okay, so now I want to ask a question. So judo has a gi, a uniform, right? The pajama-looking thing like a martial art.
Yeah.
Same sport essentially as wrestling, a little bit different rule set, but with a uniform. Jiu-jitsu has gi and no gi, right? No gi, essentially same as wrestling, has the rash guards that's skin tight. They have the shorts that are like, tight, so nothing falls out. But it's a lot more skin-to-skin contact.
Yeah.
The prevalence of skin infections in no gi versus gi, is that something that...
I don't know the data on that, and so I can't comment, but...
Yeah, you can probably assume, though, no-gi's a lot more disgusting.
My intuition would be that if the less skin that's covered, the more opportunity there is for skin infection and the transfer of infection from one person to another.
Yeah. So let's just say someone has a lesion, like a staphylococcus lesion on their arm and it's oozing. They have a barrier, which is like, let's just say a t-shirt, and they're wearing a judo gi on top.
Yeah.
I'm wearing a judo gi on top. I'm wearing a t-shirt underneath. We grapple. What is it? Much reduced risk there, or
if your skin is covered and the lesional skin is covered, there's a reduced risk. What I can't comment on is, the thickness and the transmissibility of the cloth, the fabric, et cetera, et cetera. I do want to point out that sport washes and body washes would not be appropriate for the oozy skin that you're describing. That person needs medical treatment.
Yes.
A cleanser would not be appropriate right there. Perhaps as an adjunct, but it wouldn't be a definitive treatment.
Yeah, that's a very interesting thing. Yeah, it's like kind of like wearing a mask when Corona, right? It's like how much of it is useful. You have the KN95 versus like the regular, the Uniqlo mask. It's like, what's the point of even wearing it? So it's very interesting. So let's just say, right, the guy. Here's another myth. When you have impetigo, it starts off as a pimple.
Okay.
Correct? Impetigo?
It looks like a pimple. Excuse me. It could start off as a pimple. I mean, it could just start off as like a patch of infected skin.
Okay. So sometimes it's like, oh, it looks like a pimple on my arm, and then you start messing with it, and then it starts oozing. If you leave the pimple and it doesn't break, you could still grapple without transmitting it. Is that like a myth?
Yeah, I think that's a myth. If somebody...
That's a myth.
Yeah.
All right.
So, because a pimple is a very small pustule. There's a droplet of pus. It's only a droplet, but it still has pus on the inside of it. And of course, over the course of wrestling and it getting rubbed, that pimple can open.
True. Okay, so how about another one here? Guy has a, let's say ringworm now for this hypothetical, right? Guy has a ringworm on his arm. He knows it's ringworm. He likes scraping it, putting cream on it, whatever, right? He goes, oh, it's fine because I'm taping over it with athletic tape. Sometimes they'll put like pre-wrap and then athletic tape over it. And it's fine. It's not contagious. There's a barrier. What do you say to that guy? Is that true even?
Well, what I can tell you, because I'm a physician in New York State and
Yeah.
I treat a lot of wrestlers, I know
Yeah.
what New York State's interscholastic uh, athletic association would say. And they would say that the patient needs to be treated for 72 hours, 3 days, and then
72
cover it.
hours. Oh,
And
okay.
using
Yeah.
tape or something like that would be
Mm.
sufficient, but they would have to be on treatment for at least 72 hours.
So the 72 hours is specific to ringworm or also to staph and impetigo and all the other stuff?
That's for the ringworm.
Okay. What about if it's impetigo?
Right. So I have to be honest with you. I don't know
Yeah.
if there's a minimum duration of treatment before
Yeah.
return. I do know that they're not going to let you wrestle if the lesions are still open and weeping.
Yep. So what if you're in the training room and someone says, "Hey, I taped it up. It's fine." Don't work out with that guy, right? Don't let that guy on the mat, correct? Because that pus could get on the mat, and then your face could go in the mat, and then you could still catch it.
If
Is that
they're
right?
actively infected
Yeah.
and not treated, for
Mm.
sure, no.
Mm.
If they have a resolving infection, they've been on treatment for several days, and they have it completely covered, there may be circumstances in which they could participate. But you have to be able to guarantee that the wrap that you're covering it with isn't going to come off, etc.
Yeah, yeah. Okay, so what is a good protocol? Like, for instance, like you mentioned some things that I could purchase through your website
Yeah.
right now that can kind of help me minimize all this risk. Like, I don't even want to think about it. There's stuff like defense soap and this and
Yeah.
that. But it's kind of like, I don't know if they work. Like, no one really knows much. Like I gave you like 10 myths that we hear. And we're not getting these things from dermatologists. We're getting it from other grapplers who've been grappling, who have had skin infections. That's it. So it's like, what is the protocol would you suggest if you're a grappler? Judo, jiu-jitsu, wrestling, sambo?
Yeah.
Like, what's a good one?
Okay.
I know you already kind of mentioned it, but like the full spectrum.
Okay, so the first thing that I would recommend is that after every practice and after every competition, you shower and cleanse within 30 minutes. That's number one.
30 minutes. Okay.
Number two, I think you want to use something that's going to give you full body coverage. So the clean sport wash, the clean body wash, and then Clean also has a 2-in-1 wash that has the sodium hypochlorite and also a moisturizer in it. They're in gel formulations with a squeeze top cap. So you can squeeze it into your hand, get it on your body, also use it with a shower brush, which is something that the bar soap's a little bit more difficult. It's a lot easier to get coverage with these gels with surfactants and sodium hypochlorite in it. Squeeze it, get it on your body, use a washcloth, use a shower brush. And I would use those, again, within 30 minutes of competition. The other thing that I would do is if you have dry skin, dry skin is more prone to trauma. And so the use of a moisturizer. And that actually became an official recommendation in the treatment of eczema, which is dry skin with dysfunction on the superficial layer of the skin. In December, the Joint Task Force of the American Academy of Asthma, Allergy, and Immunology and the American College of Asthma, Allergy, and Immunology recommended that over-the-counter moisturizers be used for everybody with eczema and that kind of dry skin. There are numerous excellent moisturizers that are available over the counter. Clean does have its own moisturizer that has ceramides and niacinamides in it, and those are excellent for retaining moisture and fixing tiny cracks in the skin surface.
That's really interesting. It's funny because sometimes, like when you're wrestling and stuff, some people call it greasing when they put lotion on their arm, so now they can't grab a hold of their wrist to like crank on their arm because it's slipping and sliding, right? So there's like a little bit of a fine line of like, oh, I use moisturizer on my arm, but then the other guy's like, nah, he's cheating, So,
well, I wasn't thinking
for...
of using the Clean moisturizer for a strategic advantage. And I
Yeah.
certainly wasn't thinking about it about getting an unfair edge, but if that's what people do, I'll stay out of it.
Yeah, but usually the moisturizer is okay just in the morning or something like that, and then it helps your skin be better. So there's less likelihood of infection because it's the integrity of your skin's better, right?
That's exactly right. The moisturizers preserve the integrity of the skin. It's going to be most
Yeah.
appropriate for people who are prone to dry skin, and using it once or twice a day.
Yeah.
I would probably recommend twice a day if you can do it. It's hard for a
Yeah.
busy teenage athlete, but definitely do it right after you get out of the shower when you have
Yeah.
some, moisture on
For
your body
sure.
to trap in there with the moisturizer.
Interesting. You did mention something about sun exposure. What was that about?
Well, I was talking about sun exposure at the beginning of this
Yeah.
interview in regards to causes of recurrence of a herpes outbreak. Um, a very
Mm-hmm.
strong sun exposure can bring it out
Yeah.
in a part of the body that's been previously infected. So you'll often see cold sores on people's lips in the summer. They're out in the sun at
Yes.
the beach all day, and then they'll get an eruption.
Oh, I thought like sun would do the opposite of that because bacteria doesn't like sun or something like this.
Well,
I
first
guess
of
it's the
all,
opposite.
herpes isn't a
Yeah.
bacteria; it's a
It's a
it's a
virus. Yeah.
virus, and it's a virus that actually lives within nerve endings, nerve projections in your skin forever. That it
Mm.
doesn't totally go away, which is why some people get
Man.
recurrences.
Ah.
And a direct trauma to that skin can predispose
Mm.
to a recurrence. In this case, it's not blunt trauma; it's
Yeah.
light trauma, it's photo trauma.
So will sunscreen prevent me from having an outbreak?
I would say that it would reduce the likelihood, but
Mm.
it can't fully prevent, I would guess.
Interesting. Interesting. So what are the most common areas you think for grapplers? Like I feel like this is just like a feeling. It's mostly around my face that I get it. Face, neck, and then I guess you kind of explained it already because it's not covered, right?
Yeah. Well,
Yeah.
where I see it is on any part of the body that's not covered, and I've seen it everywhere on the arms and the
Yeah.
legs. But I would agree with you. The most common place I've seen it is the face, and you
Yeah.
know, wrestlers often have their face up against the body of their competitor as
It's
they're
true.
trying to throw them or flip them.
Mm. Yeah. Okay, so here's another question. I'm wearing a rash guard at training, and there's a guy with an infection, and his infection's on his face. It gets on my rash guard, right? I take the rash guard off. I shower. I do the whole protocol. I bring the thing into my backpack, right? And then I go home and I take the thing out and I wash it. But how long can the infection materials stay like on my bag, on my whatever it is? And can I get an infection from that? Like let's just say like for instance my skin on my hands are messed up because of like grabbing the gi. You see my hands are mangled.
Yeah.
And there's a break in the skin. Like can it get in here while reaching for my bag for like a pair of socks or something like this?
So it
Or am I just
depends.
kinda
It
like hitting the
depends
question?
what kind of infectious agent is on the rash guard. Viruses are not going to live on there as long as bacteria generally,
Oh, that's interesting. That's interesting.
but like
Yeah.
a droplet of pus or something,
Mm. Yeah.
certainly for at least several hours can transmit things. So important to throw those things into the water and important to wash your hands, after you handle those materials.
Yeah. So we used to have this thing called like skin protect cream before you would wrestle. Is that a thing that you guys have, or is that a thing that you recommend, or is it just like kind of a gimmick? I have not seen this in like 10, 15 years. When I was wrestling in college, they had these like foam cans where it's like, all right, guys, circle up, and then you would spray the foam into your hand, and you would rub it all over your body, and then start wrestling.
Mhm.
I don't even know if they do that anymore. I haven't seen it since. Like, is that something that you know about?
So that's not something that clean skincare carries. As to whether or not it's a gimmick or not, I mean, I would have to know what the active ingredients are. So I can't really comment.
Hmm. Can my herpes? Sorry, I was just making it about me. But can my herpes gladiatorium get turned into like a? You see, this is why I'm not a doctor or a medical anything. I don't know these things, so excuse my ignorance. And I may really come off like a dummy here, but it can never turn into simplex 2 or 1, right? It can't just transfer in and all of a sudden I have genital herpes.
So what I think you're asking is whether it can go from one part of your body to another. You're not
Yes,
really
yeah.
asking if type 1 can turn to type 2 or type 2 can turn to type 1. You're asking if I have a herpes on my face or on my arm, can I get it to another part of my body?
Yeah, in certain parts, special parts,
If you
yes.
scratch at the lesion and then
Yeah.
you touch a different part of your body or scratch another part of your body, the answer is yes, you can auto inoculate.
Man, that's messed up. Definitely don't want to be. Man, it's kind of a disgusting sport that we all do, grappling,
Well,
right?
we're here to help.
It's just like a thing. Yeah, yeah. Okay, so top 2 recommendations for your website for grapplers who are listening. Like, what would they be? The sport wash?
The sport wash would be number 1, and number
Yeah.
2, there's a 2-in-1 that is used as both a body wash or a shampoo. The 2-in-1 is sodium hypochlorite, but it also has glycerin in it, so it's moisturizing. So if you've got wrestlers who are prone to dry skin,
Yeah.
perhaps in general they're prone to dry skin because they have eczema, or perhaps from
Yeah.
all the bathing that they're doing and the showering, they're getting dry skin. The 2-in-1, which has the sodium hypochlorite, which will help wash away microbes, but also has glycerin. So it's actually acting as a moisturizer while you're in the shower.
Nice. I have a thing that I kind of came to a conclusion by myself. Again, I'm not a medical professional, so I'm going to sound like a dummy.
Yeah.
Right? But I used to get eczema. And I used to take these super hot showers because I loved hot showers, right? And it would get crazy dry skin, and I would get this eczema, and then because of that, I would get skin infections easily. Like if I went to a wrestling room and someone had something suspicious, I would freaking get it, right? So eventually, I was like, you know what? No more hot showers for me. I stopped taking hot showers, and then again with the temperature in the showers, and then my eczema kind of went away. Is that like, a thing, or am I just kind of like making it up?
Well, let me tell you something that you're totally spot on. And that's that skin with eczema is more prone to infection. And as a matter of fact, we know that skin with eczema has higher colony counts of staph. And people who have eczema
Okay.
have
Yeah.
higher colony counts of staph even on the uninvolved skin. So you have your skin with eczema, it has high colony counts of staph in about 80% of people with eczema.
Yeah.
But even the healthy appearing skin has higher incidence of staph. And as a matter of fact, that joint task force that I spoke about in December that recommended the use of over-the-counter moisturizers, they also recommend the use of bleach baths, sodium hypochlorite baths, because it's going to improve the eczema. The mechanism of action is not exactly known, but there have been studies that shown that the use of sodium hypochlorite can reduce colony counts of Staph aureus, of staph.
When you say bleach bath, you're not talking about like taking bleach and putting it in the bath and jumping in.
Well, that's what has traditionally been done. Clean offers the bleach bath in a bottle now. But for 300 years, what has been recommended is that you fill up your bath with water, you put a cup of bleach in it, and then
a cup of bleach?
Yeah.
Wow, that sounds kind of scary.
Or half a cup of bleach. And then you go and you sit in it. Well, yeah, you got to sit in bleach, and it might get into your eyes, and it might make the bottom of the bathtub slippery. But now, not only is the use of bleach cleansing recommended for eczema, you do have it through clean only available in a bottle. So you don't have to take the bleach bath. You could take the bleach bath into the shower in the form of a bottle.
Wow, interesting. I did know a guy that would take bleach, like from, the bleach, the regular bleach, put it in gauze, and then put it on his thing, and then every other day, this is where it got nuts.
Yeah.
He would like scrape off the ringworm like this every like with a razor,
Yeah.
and then he would put the bleach gauze back on, and he would repeat it until it just kind of went away in like 2 or 3 days.
How'd that work for him?
I think good,
Yeah.
but I don't know. I really don't know. I mean, like he also probably I actually have no idea, but he swore by this method.
Yeah.
And he was like, every time I get ringworm, this is what I do, and it kills it right away, and I'm good.
I wouldn't recommend that. I certainly wouldn't recommend taking a razor to your infected skin. And I don't think that bleach should be promoted as a treatment of an infection. It can be used as a cleanser that may reduce your rate of infections in the future, but it can't be used as a treatment. But what your friend was doing by taking the bleach and putting it on a gauze, that was a big maneuver that started in World War I and what was called Dakin's solution. And Dakin, who was actually not a doctor, he was a chemist, was putting bleach in a relatively concentrated form on gauzes and putting it on battle wounds. I can't really recommend that, and that's not something that Clean Skincare offers. There are no, there's no Dakin solutions or battle dressings.
That could be your next product, razor and bleach all in one. Could you imagine? Man, there's so many.
I'm not going to take your good idea, Shintaro.
Yeah.
I'm not going to take your good idea. You've got a business there.
Man, so many I don't want to say misinformation, but there's myths, right? And when you're wrestling in high school, you have other high school kids kind of telling you this, that, and then you bring it to college, and then you just have a lifelong of grappling, and then you have all these little assumptions about skin infections, this and that.
Well, that's how adolescents get their information. They get it from one another.
It's very true. And TikTok. Yeah. So what is the difference between MRSA and Staph? And I want to know a little bit about Staphylococcus virus, because they say even right now, I don't have any skin infections, but it's living on the surface of my skin.
Yeah,
even right now, right?
So Staphylococcus aureus is a bacteria, not a virus.
Yeah.
MRSA stands for methicillin-resistant Staphylococcus aureus. So it's a strain of staph that's resistant to a specific antibiotic, methicillin. And so if you have MRSA, your treatment options are limited. If you have non-resistant Staph aureus, you have many more antibiotic options that are available to you. So both MRSA and Staph aureus, they're both Staph aureus. It's just that MRSA is referring to the antibiotics or group of antibiotics that it would be resistant to, that wouldn't be effective at treating it.
So it's significantly more dangerous to get MRSA.
Well, you can have a non-MRSA infection that's quite invasive, but at least you have lots of treatment options. The problem with MRSA is that if it does begin to get out of control, you have fewer options with which to treat it.
So when you go into the operation, any kind of an operation, I'm getting elbow surgery or something, the biggest risk is infection. It's not a staph infection, right?
Well, it could be.
That they're talking about?
It could be.
It could be. Yeah. But there's a lot of other types of infections that can potentially get into the bloodstream.
Yeah. And once you're in a hospital setting, there's going to be, for obvious reasons, even more kinds of bacteria that could be potentially harmful.
So in terms of for wrestlers and stuff, right? They're like, I have staph. Oh my God, it's MRSA. It's not reacting to treatment. When does it become dangerous? Because the myth is it starts on the skin, it spreads, it gets deep into your skin, gets into your bloodstream. Now you have a systemic infection. These are things wrestlers and grapplers are always talking about.
Well, that does happen.
I don't know.
I mean, that does happen. That's not a myth. I think, thank goodness, that's not how things go commonly. I think you just described the worst case scenario, and for the potential of something bad to happen, that's certainly a possibility, but that's not generally how it goes, thank goodness. But the fact that those things do occur is why we treat them. and why, if we could create priority, we'd want to prevent it from happening at all by keeping the skin cleansed properly.
So my friend's leg, he thought it was impetigo, let it be. He was kind of like, oh, it's just fine. It'll just dry out and it'll go cure itself. And he was putting bleach on it and
Yeah.
stuff. And eventually his whole leg swelled up.
Right.
What is that?
Well, I
Is
don't
that
know what
like
it was, but it may have been impetigo that
yeah,
got out of hand
yeah.
because it
Because he
wasn't.
was like, it's MRSA, and then yeah, he thought it was
You
MRSA,
may very
and
well
I
have
think
been
it
right.
was.
How'd
Yeah.
that end for it? Does he still have 2 legs?
No, he's good.
Okay,
He's
good.
good. Yeah. And another question. So there's a guy I know also who had this kind of a MRSA thing. So they had to give him tons of different types of antibiotics,
Yeah.
right? That wasn't. And then he claimed that it nuked his gut microbiome, and it made it very difficult for him to digest food. And then like the gastric emptying process was very affected by the treatment of the staph infection or the MRSA. Is that something that could potentially happen?
Yeah. So I don't know about his stomach emptying and the intestinal
Yeah.
transit time, but antibiotics absolutely affect your gut microbiome.
Yeah.
And it sounds to me like your friend had an MRSA infection that was resistant to numerous drugs. They had to hit
Yeah.
him with several different
Nuked him.
antibiotics, it
Yeah.
sounds like. And without a doubt, that's going to change the bacteria, including the good bacteria and the important bacteria that lives in your
Yeah.
gut, that helps you digest food, that actually helps you fight other infections. And I find that completely plausible that your friend had an MRSA infection on his
Yeah.
skin. It got out of hand. He was treated with multiple antibiotics, and then he ended up with a gastrointestinal problem. That sounds completely plausible, and I've seen that happen.
Yeah. So the number one thing that, if everyone's listening, the number one takeaway is just take a shower with your dispense soap within 30 minutes of working out. Period.
Take a shower within 30 minutes with a product that can cleanse away bacteria, fungus, and viruses, for sure.
Yeah. And the cleansing away is the surfactant side. And then some of the ingredients in your product, that's not just a surfactant, though. That's something
That's
else.
right. So a
Yeah.
surfactant is more or less a soap. It's going
Yeah. Yeah.
it's going to trap particles that are on your skin and wash it away. And there are surfactants in the body washes and sport washes that Clean produces. The sodium hypochlorite has a different mechanism of action.
Yeah.
And we know that there are studies, not of the clean body wash, but we know that there are studies of bleach, for example, that shows that it can reduce the amount of bacteria and fungus and things like that.
Wow. So interesting. Okay, so everyone take a shower, right? And how much is the defense soap? That sport one really interests me because, like, right now I go to, for instance, I train at a gym this morning, and they have their soap.
Right.
Like, not their soap, some like soap that they get wholesale. You pump it into the thing. It's like in the bathroom. I have no idea if it's like legitimate soap or not. You know what I mean? It's probably some cheap stuff, And then even at my gym, it's like some people bring in their own soap and they just leave it in the shower. So it's like, oh, let me use this, let me use that. So if I were to pick a product from your line,
yeah,
right?
Well, we don't make
in my
defense
gym.
soap. That's a different company's stuff.
Yeah.
That's a bar of soap. We make the.
Oh no, not that. What your?
Yeah, well,
what can I purchase from
with
you?
depending on whether you have a coupon or a promotion code or something, it'll cost in the 20s for.
Oh wow.
For a full bottle.
I thought it was gonna be a lot more. I don't know why.
No, it's not.
I'm thinking to myself like, can prevent MRSA and prevent this, and like, you won't have staph on your face. I'm like, I'll pay a lot for that,
No, with certainly
so
with a coupon and a promotion code, and even without, it's going to cost in the 20s.
Awesome. So, any other advice you have for some young grapplers who are dealing with some of this stuff?
I think that if they have eczema and they're grappling, they should treat the eczema.
Okay.
And certainly bleach cleansers is now an official recommendation, and also the use of over-the-counter moisturizers. That is one thing. Number two, as we've kept saying, shower as close after an event, a competition or a practice as possible, and also clean your apparel daily if you need to. And a third thing that I would recommend is that you be very cognizant of skin that's not intact.
Yeah, got it. This is purely for myself, but like if I do a morning SPF, right, like a sunscreen, and then if I do a retinol solution at night, like for my age, I don't want to look old, right? I'm about to turn 40. What does vitamin C do in this? Because all the skincare people are like, vitamin C is good for your skin, and when should I add that in? In the morning or at night?
Right.
Like a vitamin C serum.
So
this is purely for me.
Right. So vitamin C is an important cofactor in the cross-linking of collagen, which is a protein that's found in skin and bones and the gums of your teeth. I don't think you're going to run into too many problems unless you're vitamin C deficient.
Oh, so you don't need to actually put vitamin C on your forehead.
I think if you have a healthy amount of vitamin C in your diet from fruits and vegetables and things like that, you're going to be okay.
All right, that's good to know. All right, thank you so much. Where can we find your product one more time so the people who are listening can go buy it?
So the name of the company is Clean, capital C, capital L, lowercase n. It's Clean Skincare. You can find all the products on Amazon, and you can also find it on the company website, cleanwash.com, CLNWASH.com.
Awesome. Thank you so much.